finish this very quickly. Are you the one doing it?
Good morning, ladies and gentlemen.
2 minutes.
So I'll be very, very fast. So this is our presentation for the Ghana group. We've put the stakeholders. We have put the strategies according to the stakeholders, and then what we have big as the advocacy issues. We have strategy, we have advocacy issue, time frame, and the responsibility, the responsible bodies. One, for government, we are saying the strategy will be evidence-based advocacy, engaging government. And the advocacy issue will be address limited access to sexual reproductive health and right information and services, high incidence pregnancy, and poor AIDS antenatal care attendance. We are requesting that they incorporate SRHR in pre-service training for health workers, allocate sufficient resources for provision of SRHR services, ensure conducive environment for young people to exercise their SRHR, approve the SRHR policy that has been shelved for long. Honorable Member of Parliament is here, and we have a policy on SRHR that has been shelved for a number of years, and we are asking government to make it a strengthen supply chain management for SRHR commodity availability. Yesterday, Dr. Rosling spoke to poor supply chain, that commodities like modern family planning methods are not available in those facilities, and now we are tasking government to ensure that they avail these facilities. She also spoke about some facilities having a lot that even expire, others are not having. We also talking about embracing social inclusion without leaving out anyone, as much as possible. Make sure that everyone is included, people with disabilities, and in most cases, left out in our programming, and we are pushing government to ensure that everyone is included, including those traditional marginalized individuals. The timeline will be 2015 and 2025, 2026, and the responsible person will be, please come down, just come down. Health workers, capacity building. Well, we are looking at providing health workers with guidelines and protocols and job aids relating to SRHR, mentorship on delivering SRHR and positive attitude, incorporating SRHR in service. That health workers should uptake these trainings as they get into the system, ensuring continuous medical education. We know that knowledge has to be continuously graduated, and now this is something that we are speaking that as the Minister of Health, Minister of Education, and civil society organizations should ensure that health workers are continuously educated. In service training for health workers on language, on sign language, this is looking at ensuring inclusion of people like people who are not able to see. Most times people fail to access services because of disabilities, and we are requesting that government should train, Minister of Health should train health workers to be able to use sign language. Now, gatekeepers. For gatekeepers, we are looking at the strategy will be continuous sensitization through preparing relevant materials about SRHR and specific gatekeepers, religious, cultural leaders, political leaders, community leaders, engaging them in training regarding SRHR. Empowering legal knowledge to support the litigation processes of sexual abuse, as much as possible want these gatekeepers to support whenever there is a violation of a right related to SRHR. Disseminate accurate information on SRHR and implication of abuse. For young people, the strategy will be meaningful participation through involvement of young people in advocacy efforts of their rights, engaging young people in meaningful policy formulation process, involving them in program design and raising awareness that will be spearheaded by young people organization and government and legislators. Then finally, regional bodies. The strategy will be country-specific approaches, enhancing country-specific approaches through fostering local solutions for local challenges, sharing success stories for knowledge sharing, strengthening regional collaborations, ensuring countries ratify and domesticate legal and policy frameworks and offer oversight. And we are looking at regional bodies like ECOWAS, African Union, East African Communities, SADC, UN, and we're giving a margin of 2025-2027. That's what we want to come up with as a strategic action point. Thank you very much.
They've done some good work, right?
Yeah.
They've done some good work, right?
Yeah.
So
They need a better clap.
better clap.
So I'm going to relax, guys. Calm down.
Coming very fast.
So we're going to teach them our Wakanda. We're going to give them our Wakanda. Okay? So when I say Wakanda, who ha? Okay? So when I say Wakanda, who ha? You have to make the noises. Okay? Let's try.
Not a soprano.
The men, we're not sharing the men. Okay? Let's start. Wakanda. Who ha?
Nice. Kenyans in the house. It's a time to shine. Yes, though.
Wait, so could we do something akin to the peer review process? It's not a critique, but it's just anybody who has got just some citations, question on how to maybe for next something better. So yeah, we can also garner some help if anybody has something to say.
Great. So Doc says if you feel like there's a place Uganda needs to upgrade or you want them to maintain. Yes, thank you. I see he has a
So I think he is right because it was an oversight.
yes, sure.
UPR is very important because that's when our Uganda Human Rights Commission helps to pull out issues where we have rights violation in the health facilities, and it gives that report showing how health workers are offering services and where they are violating the rights of the people, and that report is usually disseminated. Personally, I've been part of the group that was ensuring that before joining government, that government has to embrace human rights-based approach to SRH services. And I was using that report vividly as the UN staff who hold government accountable. So to me, I think it's very important that we all embrace that, use that report, and at times it helps because those are very important documents. Thank you for being here.
Thank you so much for that.
All right, and that's
I would like to maybe also suggest maybe a process issue, because I think in as much as of course there may be what they presented might be unique to Uganda, but other countries might also start borrowing from each other. So I was thinking, is there any chance that maybe we can present for all the groups and then have a discussion after? So if there's already what we want to borrow from each other, and now the conversation becomes more specific on particular actions, entity, whatever the case might be. I don't know if that's
yes,
that's
that's yeah, okay, that's so I misunderstood me a little bit, but that was interesting because I was saying, can we do a UPR where people from other countries look at you and they make some citations, like give a UPR mechanism where you look at you. But that's another citation, and let's present everything, and then we make the citation. So let's do that. Which other country?
So we are going to Kenya, but before we go to Kenya, Kenyans, I hope you are ready to stand and dance. And as they're coming to dance, let's also join them. And so as Kenyans are preparing, if you did not or if you forgot to register yourself at the entrance, kindly go and submit your details at the desk outside the door. If by any chance you entered without registering yourself, please go and give out your details. Thank you. So, Team Kenya, are we ready? Team Kenya, let's rise. Team Kenya, where are we beginning from?
We're not many.
I know we are not many, but we are many. We are many. We are not many, but we are many. That's what we can say. Okay, let's stand. Everybody, let's stand for that.
Extra pressure.
Team Kenya,
No number
guys, let's rise up. Let's rise up. Let's rise up. People are seated. People are still seated. People are still seated. Who is sitting when we are looking at extra pressure? No, everybody to rise. Not just Kenyans. So let's go, DJ. Begin Kenyan.
Extra pressure, baby, when you want man go.
Look at mine. For the Kenyans.
Follow you where you're going. If I make you my business, it's up and low. Something that man is showing. Go for us, can't say right. Baby, no love. Keep me away, take you on tour. Pretty baby, I can't show you to live for. Extra pressure, baby, when you want and go. You can let the boy have fun. You can let my boy have fun. You can let the boy.
If you do this, you might do that last time. Don't worry, we are coming back. It's usually short and sweet. If we overdo, usually short and sweet. Okay. So Kenya is here. So again, if you forgot to register your details at the desk outside, I can remember to do that.
Okay, so we'll first start with the strategies for engagement. We'll start with the government. We have combined for all arms of government, that is the judiciary, the legislature, and the executive. So one will be development of policy briefs. This is just like summaries that are meant to inspire actions, and especially for our legislators. We had someone here say that they would need support in having the legislators better understand what is contained in the policy documents, and especially regional frameworks that touch on sexual and reproductive health. Then capacities building legislatures on SRHR access. We mostly assume that our legislatures know everything that needs to do with SRHR. They're well equipped in terms of information. So when we are demanding from a point of you already know these things. But sometimes most of them do not have the information they need, and that can be a hindrance to them inspiring action. So capacity building as a form of inspiring action and giving them information, as well as having them as allies with us. Identification of SRHR champions, especially in the National Assembly and the Senate. We have parliamentary working groups. We have Kenya's Young Parliamentarian Associations who are willing to come on board and support young people and advance the rights and freedoms of young people, as well as of engagement in technical working groups, mostly put together by the county and the national government, in terms of just trying to come up with strategies for improving access to sexual and reproductive health for young people, children, and adolescents. First would be to reach out to them in schools and colleges as a way of equipping them with the information they need, and also educating them on their rights. We start from a point of self-advocacy before you can go and advocate at a higher level. So reaching out to them in schools and colleges and equipping them with the information that they will need to advocate for themselves. Josephine had said something about her being empowered and her having an easy time because of the information that she has. Not so many people are able to self-advocate for themselves when it comes to when their rights are being violated. And then capacity building on meaningful youth engagement, not just tokenism as a form of youth engagement, but ensuring that young people have the information and the capacity they need to actively participate in spaces and decision making, and not just to tick a box. Then capacity building of policy development and review processes. This is very crucial. We were talking about the 15% allocation in terms of budgetary allocation. Most people never participate in the budgeting processes because of lack of information on how to navigate the process. So this is part of what should go into capacity building young people. Then health workers, BCATs on youth-friendly services, value clarification and attitude transformation exercises, so that they can examine their biases when it comes to provision of services and improve on that. The dialogue between service providers and young people. As young people, we're very diverse, and so are our needs. So having diverse people in the room, talking to service providers and helping them understand the diversity that diverse young people have will be one of the strategies we will use. For gatekeepers, awareness creation on access to SRHR and using the community handbook that has been developed by the Ministry of Health to advance sexual and reproductive health and Ghana support. Then capacity building parents and community health information, community health promoters to offer SRHR information and service. Some of the challenges that we expect to see are opposition groups. So we will need to work on opposition monitoring, because most of the time civil societies and allies are usually being captured to the opposition. Then cultural and community biases is one of the challenges that we expect to have. Limited resources to engage in and to conduct most of these activities, as well as legal challenges. This is with regard to our policy environment and what the policies say in terms of age of consent, as well as in terms of how young people present themselves in their various diversities. Thank you.
Thank you so much, Joanna. Please stand down. We're going to give you kisses. We're going to teach you different claps this week. So we're going to blow kisses for her, okay? This is how we are going to do it. 1, 2, 3. 1, 2, 3. 1, 2, 3. Okay. Okay, let's start. 1, 2, 3.
So the next thing we're having is Malawi, but before Malawi comes in, don't say if you feel like there's something we need to improve, something you feel we need to change, please, this is the time. Where do we begin from? Or we do all of them first?
Yes.
Great.
So people just note.
Beautiful.
They note and then it will be.
Beautiful, beautiful. Thank you so much to Kenya. So the next team is Malawi. Malawi, are you in the house?
Yes.
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 Okay, let's all rise up. Let's all rise up for Malawi for 1 minute. Let's all rise up. And DJ, do your thing. DJ, give us that thing. Hey. If people are seated around you, do me a favor. Do me a favor. If somebody is seated at you, do me a favor. And also check.
Yes.
If you don't realize how important culture is and how strong culture is, I don't know if you've seen it in this room. Thank you so much.
Youth oye. Viva, viva, viva. Yeah, thank you. It's now Team Malawi. Team Malawi, we also had to target different stakeholders, the government. So we had to see what what strategy can we employ for the executive, for legislature, and even for judiciary. So for executive, we are saying that this one has a huge role to mobilize resources towards research. So we need to make sure that when you are doing our advocacy, we should also make sure that the government provide enough resources to make sure that HR intervention, that the young people are really implemented. What we're talking about maybe investing in flight trainers, investing in young people. We should make sure that they are available resources. And the government has to be a champion in revising the policy, especially that executive part. So the revision of research policy and harmonization of research policy, it needs to start with the government, the will of the government, to align with the needs of young people, and to make sure that it's even in line with the context that we are in. So the government has a huge role. So those in terms of harmonization, we highlighted, like, for example, education, health, youth, and integrated growth. I think those are critical policies that can really help in terms of achieving SRSHA. And the government executive has also a law to domesticate of regional communities and protocols. Because we've been complaining about this, so just need to make sure that the government is able to make sure that it's really domesticated in our respective countries. And also establish and strengthen accountability mechanisms at all levels. Everyone needs to be held accountable. Even a young person, even a health worker, every level has to make sure that we have good mechanisms where we can hold each other accountable and establish platform for inter-ministry coordination. Yeah, like ministers from the other countries. When you see problems of Africa are just the same. So we need to have those kind of inter-ministry coordination. So if I go to yes, legislature, I think we just need to make sure parliamentarians they have a law to make sure that there is appropriate resources, adequate resources for SRHR, review of relevant pieces of SRHR, and then the advocacy to make sure that what we're talking about is really happening. And for judiciary, deliberate intervention to engage by the ministers to interpret SRHR laws. So maybe we can all understand, we can all have uniform understanding. Health workers, capacity building on the SRHR level and the policy frameworks, they also need to know, and the awareness and community engagement through respective health facilities to participate in making the community aware about SRHR. And young people, capacity building on SRHR advocacy
and social accountability. We really tried the intervention and even probably the awareness. You can see the social accountability monitoring, that's very key to be able to try. And regional bodies also had to suggest that enact regional commitments and protocols. That's the law. We should see what's relevant for Africa. That's the law for regional bodies to make sure that that one is enacted. Hold member states accountable for the domestication of regional commitments. We can all have all those commitments, but they are nothing if the regional bodies, they are not holding member states accountable. So we should make sure that the regional bodies are heavily held accountable member states. Then strengthening collaboration mechanism among member states. What are the opportunities we have in Zambia, Zimbabwe, and how can we utilize those opportunities and make one thing Africa solution? Resource mobilization and technical support. We need more resources and also make sure that we also provide technical support. So that's it for Malan. Thank you.
Nice. Okay, so our way of appreciating them, I want us to give them one hearty clap. Are you together? One hearty clap. So if your neighbor is communicating, please tell them it's time for the clap. Thank you.
Is there any randomly put their phones down all of a sudden?
Okay, so I want us to give Malawi one hearty clap. 1, 2, let's go! It didn't hit well. 1, 2, let's go! It didn't hit well. 1, 2, let's go! Did it hit well? No. Okay, the final one. When I say 3, then you clap. 1, 2, 3. Feeling you've been communicating.
So we give you Wakana. Are you okay with Wakana? Okay.
Nanda.
What is the language?
Oh, so the
It's showering, it's raining, stand up!
This is awesome. Thank you. It's also good to appreciate yourself. Thank you. So we're going to the country that we were told by Jeremiah it was named after one of the longest rivers in Africa. Zambia. Zambians, are we in the house? Yes. Zambians, are we in the house?
Yes.
Zambians, are we in the house?
Yes.
Okay, let's all rise up for Zambia. Easy, are you ready? Let's all rise up for Zambia.
Zambians, let's meet the
DJ. This energy feels like you can do it yourselves. DJ, let's go.
DJ. No, that's not
DJ. Jeremy, let's go. Jeremy, come on, Jeremy. Okay, DJ, let's go.
As I wait for the music, can we go in front? And then we go from the front.
This is the real meaning of nothing for us. A meaningful youth. So somebody came from your group and came out a point and you are not against. Okay, let's go.
Thank you, Zambia Kuchalo. Energy. Zambia Kuchalo. Zambia Kuchalo.
So good morning, ladies and gentlemen. So firstly,
Let's give Zambia time.
one meeting, colleagues. That's colleagues. Thank you. Yeah. So on the strategies, we are firstly suggesting that the government, as a key stakeholder, could strengthen the coordination of the existing structures that are there, and such structures include the national technical working groups that are there to ensure that the access of sexual reproductive health services is effective in our country. And also, in terms of the legislature as an arm of government, there could be collaborating of youth-led CSOs and parliamentary caucuses, as well as the establishing of a task force on access to SRHR services, which would be basically a mirror of the CSE task force in our country. And the other thing is ensuring the meaningful participation of young people in the process of formulating the budget, analyzing the budget, and ensuring that enough resources are allocated to the conversation in the room. On health workers, it would be important that the first strategy that could be employed is building their capacity to meet the needs of adolescents and young people. And then on the gatekeepers, as we have been identifying from the first day of this meeting, there is need that their capacity is built. There's also need that they have enough information concerning the needs of the young people, as well as them fully understanding how best these needs can be met, as well as what role they can play. Therefore, community engagement will be key through dialogue meetings as well as indabas. Some of you may be aware that in the recent past, our country has been holding indabas, and we've been privileged to be able to reduce the provincial level, the district level, but still there could be more concerted efforts through different players to help these individuals understand their roles and how best the needs of the adolescents and young people can be met. Parents as well. Capacity building for parents is also important. Like we heard yesterday, Doc talked about very amazing things, or very exciting and delightful things about how a child grows. And this would be important for parents to understand, so that they also now better understand what role they can play and what strategies they can employ to better meet the needs of the young people, to better facilitate the access of sexual reproductive health services. Adolescents and young people are a key player in the conversation, and therefore it is important, as we have been saying this morning, that their capacity is built so that at every level of their advocacy, they're efficient and they're speaking as they should. Even in the way they act, they also are correctly informed in their direction. Another thing that could be done in engaging young people is a lot more engagement through social media, as it is evident that a lot of young people are on social media. A lot of young people are learning a lot of things through social media, and it would be important that they are engaged a little bit more through social media, considering the amount of time that they spend on social media. I think it is also important to note that we currently have the National Adolescent Health Strategy that is being implemented. There's an attempt to implement this strategy, but one key thing that has been identified is the implementation is not up to par for resources, because of challenges such as resources, as well as coordination of the key players in the conversation, CSOs, young people, the government itself. There is challenges in coordinating because of things such as resources, and this can be done better if more concerted efforts are evidenced and people come together to be able to put resources together and better implement this particular strategy. And then I think I've earlier mentioned about the formulation of an SRHR Youth Access Task Force at every level, starting from the community, the district, the province, and at national level, so that it's not just advocacy at the national level, it's not just advocacy at the provincial level. It will help meet the needs of each and every level of the country. What would happen under this task force is that different capabilities or different people with different capabilities will be put together, lawyers, young people who understand different sections of the community will come together and do a mapping of what strategy would best work. Most importantly, it would be very important to enhance monitoring and evaluation through existing reporting mechanisms and identify the key moments in which reports or CSOs ought to report to the relevant stakeholders on what is working in their implementation of strategies that will improve access to SRH services, as well as adequately submitting their impact evaluation in the various interventions in their community, the country, the province, and the country at large. Thank you.
Thank you so much. Thank you so much. Relax. Let's not be so fast. So in Kenya, you say come slow. You say come slow. The interpretation of that statement is entirely prophesied. So I want us to appreciate Team Zambia, and they have said they have taught me some little language that's used here. They say we want to take them to the world. You realize that it's the only team that has done their presentation using. So we want to take them to the world, right? We want to take them to the world. So we shall be clapping like this. Zambia Kutando. You get it? You get it? If you don't get it, forget about it. Okay, let's go. Zambia Kutando. Again. Zambia Kutando. Thank you so much.
Thank you. Now we're off to Team Zimbabwe.
Yes.
We are off to Zimbabwe.
Bye-bye.
Okay, DJ. Team
Okay, thank you. So, Zimbabwe are saying they've not felt it. Have they felt it? Zimbabwe, have you felt it? Okay, listen, they are asking that you give them once more.
Another one.
Another song.
Yes.
Which one do you want?
Kero, I'm David Usungeba.
Okay, order. Let's all have one meeting, please. Okay, great.
Guys, you are trying to buy time. The person who has the presentation from Zimbabwe, they are going to the washroom, so they are coming back. Want to keep some high there. Oh, so you do for all of us. DJ, are you going to speak? Can you make
We want South African song. Oh, a South African song. Oh, hey, oh, Lumba.
Wait. As we play the song. Wait.
Let's keep quiet first. Hello, if you can hear me clap once. You can hear me clap once. Thank you.
So kindly to Zimbabwe, can you find out who has your presentation? They're here?
Nice.
Okay, great. So people are saying, if you play another Zimbabwe song, Kenyans will want, Zambians will want, Malawians will want.
People who fornicate.
Okay, let's welcome the presenter to the stage.
We've been told we are the hosts, so we might as well give it to them. DJ after presentation.
This song when I was young, I thought it was made in Kenya.
Alright, hello everyone.
Hello.
For using the quote that Zimbabweans at the side of cheese. Every Zimbabwean that you see is a Saja cheese.
Yes.
Well, which you are going in this direction. The Saja cheese. Allow us to exercise our right there. Alright, so after the presentation for Zimbabwe, how we approach this, we were informed by the stakeholder engagement analysis matrix, whereby we are saying among our stakeholders who has got the highest power and highest influence. Sometimes we find a stakeholder with both high power and high influence. So we just decided to list all of our stakeholders that are very important in terms of sexual and reproductive health and rights. So on the top there we've got our government, but then we disaggregated it to say in terms of our government, we're looking at the Ministry of Health, the Ministry of Primary and Secondary Education, the Ministry of Higher and Tertiary Education, the Ministry of Justice. So for the Ministry of Health, the overarching strategy in terms of our approach to government is the multi-sectoral approach. I think even as a country, we have developed the multi-sectoral approach in terms of how we approach everything, because for us, health is just not a health component issue, but it affects all the other government departments. So we now also have an intergovernmental ministerial approach arrangement within our country. So in terms of our government, we're looking at the high-level policy dialogues. When it comes to our Ministry of Primary and Secondary Education, we realize in terms of learners, they are the ones who are responsible for making sure that our learners who are in school, we make the bulk of our adolescents with access. So here we are talking about implementation of community support actions. We are looking at implementation of comprehensive sexuality education and the school policy. So our biggest strategy is sensitization. So they understand the importance why we need to have those components functioning in schools. When we go to the Ministry of Higher and Tertiary Education, our strategy is to emphasize on life skills investment. So for us, it's trying to that the ministry appreciate the importance. So our life skills investment goes beyond academics, but is integrated into our. So and we also have in terms of our Ministry of in terms of our Ministry of Justice, here we are looking at our legal and policy clarity and review. So our strategy is to go in there and initiate the legal and policy clarity review, looking at seeking legal opinions and clarity. And then our Ministry of Finance, we have actually realized this is a key player because it all boils down to money. Whatever we need to do, if we don't have money, we can do everything else, but from the authorized declaration of this requires money. So the Ministry of Finance is very key in ensuring that they understand the importance of investing in health. So our priority in terms of strategic direction is to ensure that they understand this, and this involves involvement, support, mobilization of resources in terms of the action. Then we also have the Ministry of Youth. Our strategy is to integrate a mainstream of youth issues. This is the Ministry which is responsible for all youth. So now we are big on integration as a strategy. And then this also involves them mobilizing the youth as well. When it comes to the Parliament, our strategy is to make sure that there is review, introduction, and removal of appropriate legal instruments. So here we've got our public hearings in terms of our actions, our petitions, our dialogues. And then another key stakeholder is our parents in all their diversity. So here our strategy is persuasive and negotiated regular discussion. So we are saying that you can do everything else, but if the parent says, my child is not doing that, they won't do it. So here we are saying we need to persuade the parents, and the strategy for engagement is persuasive and negotiative dialogues. We can make the parents be on the same page and be supportive. So here we're doing community dialogues and then facilitating dialogues as well. And for traditional leadership, these actually play a very critical role when it comes to our rural areas. They are the gatekeepers of the community. So here in terms of our approach, we are looking at the community dialogue. This is where we talk about community visioning, allowing the traditional leadership to also be the one that directs the vision for their communities, bringing about traditional laws or bylaws at the local level in terms of where their domain of operation is. And then we go to the media. In terms of the media, our approach is responsible reporting. Sometimes the media, the issue that they are reporting is very valid, but how they miscommunicate when it comes to the level of journalism, it then sometimes distorts the messages that we're trying to communicate, and we realize the media is a very important stakeholder. So sensitization meetings and then facilitated trainings And then another key stakeholder there you mentioned is the private sector. So in terms of the private sector, they're not charity organizations, they're in need for money. So you need to have a value proposition as a strategy. If you are saying me as a pharmacy, I'm supposed to support you, what value proposition is it to me as a business? So value proposition is something that we can really begin to think of how do we work with the private sector and ensure that on their end is also a value proposition. And then sometimes the private sector can also help. Some of the things that you cannot go and communicate with government, they've got platforms where they can mediate and bring out some of the issues that you cannot be able to really air out, especially when it comes to procurement, commodities, and all of those other things. And then we look at our CSOs. So in terms of our CSOs, you see we are all and you are asked things that when it comes to civil society organizations, although we've got different civil society organizations, we are just whatever we are working to do that we're putting the youth at the center. So I'll not dwell much on the different civil society organizations that we have. But from us as Team Zimbabwe, I'll just touch a bit on the challenges, the issues of continuity. To say sometimes we invest so much in trainings and then people change. They go to other institutions, and especially around Africa, there's a lot of brain drain. People also leaving for European countries where they think there's greener pastures. So it is actually very important that now we streamline and transition also to government. If government is capacitated, then it becomes something that anyone who joins government, they're always being oriented on what needs to be done. So continuity is also a challenge. Cultural religious beliefs, but I think culture is meant to serve its people, and as people we can always evolve. So continuous dialogue can also be able to help us. So from Zimbabwe, there was a presentation at the SADC chairmanship. I think now we all have a
Wow. Nice. So we want to welcome somebody to appreciate the chairmanship.
Good afternoon once again. As the SADC chair, I want to show you how you're going to appreciate us. Now you can look where I am, not the SADC chair. You look, turn around, SADC chair. He told us that, yes. So you're going to clap 3 times and you're going to see Igwe like this. Ladies, you're going to clap like this. Gents, like. Everybody else, look for where you fit in. Look for where you fit in it. I say it 3 times. 1, 2, 3. Igwe. Okay. So let's go. 2, 3. Igwe. Thank you. Yes. No. Briefly. So we're just going to say 1, 2, 3, Wuchi. Hani. Okay? 1, 2, 3, go.
Wuchi. Okay, thank you everybody. Before we hand it over to Doc, I want us to appreciate ourselves. And how we're going to do that is a clap that goes like this.
Yes.
Great, over to you.
It's been quite a lot of clapping. For the music and dance was not totally. No, there's no. Everyone has got the high spots. All right, so as we say, I think we can now make our other input. You might, anybody might just want to make a general that says okay, or you might want to make a specific country. Allow me as facilitator. So some countries didn't really do anything on the regional politics. And but it might be, I was thinking, why it might be maybe we don't really understand what the regional body could do. So I could make a suggestion that we should see whether we can have affiliate status with the African Committee of Experts. So the affiliation status means that if you are an NGO, you can have you can apply for affiliation with the African Committee of Experts. So then you now participate a little bit deeper in its work. Okay, so how it would work is in your countries, if you could do whatever is the policy review or briefs or whatever, and then when there's a meeting at the African Committee of Experts, you are invited to present what is obtained in your country, so that the African Committee of Experts now can take it up. So it can take it up, it can take up issues of the inconsistent harmonization of policies, and because it's a legal body, it will articulate it according to the standards and then give back feedback to your country. So that is another powerful way in which now the Minister of Health Justice gets feedback from the African Committee of Experts. Because we have ratified that document, then government takes that feedback seriously. So that is one way in which the concrete steps are seek affiliation status with the African Committee of Experts, and then you make that kind of contribution so that you can enable that, you can empower the African Committee of Experts to speak to the government. So that is my input. Now, any other inputs for people to beef up particular countries or in general? Welcome.
Thank you. I made a few notes, and I just thought maybe to make it more as a general comment, to also really encourage us to, first of all, really understand where you are as a country, because I think most times when we put, work plans or action strategies and so on, sometimes we come up with quote unquote very generic actions, or engage leaders and engage this and engage that. But a deep understanding of where you are as a country will really help you sort of like really zone in. Yes, all stakeholders are important, but with where you are, which one is the most important stakeholder? And then, I've even written down, please pick the 2 to 3 issues that you think are the most important, and obsess over those 2 to 3 issues until they are addressed. Then you move on to the next, because the honest truth is there are a lot of issues out there, but the more we are thinly spread, the more we start to wonder why, we go into a project, a 5-year project, at the end of the 5 years, we still can't really properly touch what we've done, maybe because we're spreading ourselves too thin. So just as an encouragement, to pick fewer issues, pick fewer stakeholders, but obsess until we get the win. Yeah, thank you.
Thank you, the very person who has just presented. I want to add on something a little bit on the most important stakeholder. I want to take it as an example of Uganda. We have all the laws, we have everything, but the most important stakeholder in this are religious leaders and country leaders. They are the ones that are pulling everything down. Parents down there. I was asking myself here, where Doctor, you were saying, how do we empower young people to ensure that they know their rights and go ahead to demand for their rights? So I was discussing it here with my fellow Ugandans. At what level? Because children have different levels of where they can demand their rights. They can demand their rights at family level, their rights at community level, their rights maybe at government or national level.
But at family level, how are children going to demand for their rights? You are a mere young girl of 17, of 16, and you stand before your parents in our culture, and you're like, this is my right, I have to come home at the time I want, because I'm attending my friend's birthday. Whose gate are you knocking on? And whose money are you going to take for your next tuition? Are we together? So as we tell these people to demand their rights and go ahead and exercise them, we need to know at what level. What are you doing? You are a young adult, you have finished university, but you're still staying under your father's roof. You're still feeding on their wallet. How are you demanding your rights? I want to tell you the truth. I told you when it comes to youth, I speak the truth. Poor people have no rights. You know that? As long as you're still depending on someone, your rights will always be suppressed. So as we tell young people to demand for their rights, we need to look for these most important stakeholders and we deal with them. How can we engage parents to ensure that we change their mindset? That this is my daughter. However much I cage this daughter, it cannot stop her from, getting spoiled. And then we sit on the table, parent and daughter, and we get a resolution. Short of that, we are going to send young people to demand for their rights. At the end of it all, we will have so many young people out of school because they have knocked with their parents. Thank you.
Go ahead. Go ahead.
So mine is just a general. Mine is a general comment to say, for young people, I think you also have to assist the stakeholders in defining what exactly, for example, you mean by youth-friendly services, because sitting here, I'm over 40. What I might think is youth-friendly is not what you think is youth-friendly. We are implementing the DREAMS program in Zimbabwe that is purely focusing on adolescent girls and young women. We have really tried to make our services youth-friendly, but they might not be meeting the needs of the young people. So I want to encourage especially youth from Zimbabwe and even from other countries that as you interact with the stakeholders, please give us the granular details. When you walk into a facility, to a health facility, how do you want to be treated? What exactly is being, what exactly are your expectations? How does the nurse become youth-friendly to you? Because at times we take these terms for granted. Even when we are training, we might assume that we are doing the right thing, yet we are missing it. So that we don't continue to have these conversations to say youths may be denied or discriminated when they are accessing sexual and reproductive rights. But give us the granular details and we are going to assist you. Thank you very much.
Okay, thank you so much. Mine is a quick one on evidence building and learning. I think across all the presentation, I can note that there hasn't been a lot of appetite in terms of research in generating evidence on what is working and what is not. And I feel that as a region, really, there's been a lot of investments that have been made into interventions. And sometimes in our context, people have access to information, they have access to services, but we see a lot of teenage pregnancies going up. It's like the more investments are made, the more the results are retrogressing in the other direction. And you may beg to ask a question, why? That question is unanswered, right? So I feel like we really need to be intentional about what's working and really taking that information, that body of knowledge to scale so that we are learning. So whatever intervention we plan to put across, may I challenge us to really put research as inherent component to that. And even in gatherings like this, I think it would be nice to reflect on what's working from a very informed empirical evidence. I just thought I should speak to that.
All right, I think you saw from the lady was talking about youth friendly service provision. Right. So I think in as much as young people can come and say, you know what, we need 1, 2, 3, 4, 5 things. Let me give you a practical example. Right now we know that condom funding is no longer there. And when you put us young people at a table, you ask us, what do you want? We tell you want flavored condoms, right? But do we have the resources to actually purchase the flavored condoms? The answer is no. So then at the end of the day, when we come and say whatever we want, when then the result comes at the end, we feel like it was for nothing because the flavored condom is not there, not because someone doesn't want to, but because the resources are not allowing it to. So from a perspective of me as a young person, I think it's also time that we have realistic conversations. If you're teenagers, tell us in terms of your financing, what is there? So like when you are contributing to say as young people, we need 1, 2, 3, 4, 5 things. We are saying 1, 2, 3, 4, 5 things that are also in line with the budget and what can be done and what cannot be done. Because at the end of the day, we all come with our different expectations and we end up feeling frustrated when those things do not seem to come. And secondly, I feel like we also need to teach young people the importance of responsibility. In as much as we're expecting healthcare providers to be nice, you also as an individual, you need to be nice because attitude is so reciprocated. If I walk also into a facility and I've got my attitude, it can also reflect sometimes on the healthcare provider. So that dual responsibility between me as a young person and also the healthcare provider can work. And then also generally in terms of the evidence, I think we had a discussion about what role can the regional bodies do. I actually feel that the regional bodies can actually do a lot of work in terms of compiling what is working, provide those learning platforms between countries. For instance, regional bodies like AU, SADC, they've got a greater wide reach, which they can even play a very critical role in actually providing that platform whereby countries can actually learn from each other, gather the best practices from the different countries, and that could actually help us in terms of also seeing what works. And then another challenging issue I think is about when it comes to data. The reason why do we say this has worked and it still keeps increasing? How much have we invested as a country to know how many young people are in our countries? If we make efforts to disaggregate that data by age, by population, so that we can really have a true reflection and estimate of how many people are there and how many resources that we need based on our geographical or even our population estimates. And these are some of the things that you find data in most of our African countries in the management of data systems is something that we're still at a long way off to go. And that actually means sometimes resources are allocated and we put more resources where they are not needed because we actually do not have a groundwork basis for us to make informed decisions based on the data that is available. Thank you all.
Thank you so much, SADC Chair, for that contribution. So just to build on to what you said about data and information that is available. So as HEVOS, through the Regional Research Fund, we developed contextual analysis for the 4 focus countries on the age of access. So we tried to bring out key activities that are working in a particular country. So we tried to focus on, from a CSO perspective, what is working, government perspective, what is working. And we also developed a policy brief on the issues around the age of consent. So I don't know if we all managed to scan those QR codes that are on the wall, so you can access some of the information. I should mention that the information that's in the contextual analysis should be updated. These were done about 2 years ago. So we need to also update contextual analysis, but I think that's a starting point for all of us. And I think Doc will speak to this. Ultimately, from here, we are going to come up with some form of a technical brief that's also probably going to guide us on what is working in the region, how can we collaborate and coordinate as different countries when it comes to issues around access to research services, especially access to consent. So once that is finalized, we will then circulate with all of us in this space so that you can also are able to provide your input as well as validate the document before we finalize the process. Thank you.
Amazing, amazing. It speaks so much about from policy to practice, from the boardroom to the community, right? Go ahead.
I'm sorry, I'm getting to the mic. I want to know this from you guys. I told you that before I got into politics, I was in Ministry of Health. And it was my passion to ensure that key populations get friendly services. And I moved in 145 districts in Uganda. And the main issue that was making me move was to sensitize health workers on how to provide friendly services to key populations. Key populations, looking at our African setting, most of these key populations, people will not even want to hear about them, especially men who have sex with men, you know. I told you I work, even when I'm a member of parliament right now, I work with sex work organizations. My passion has remained with these vulnerable people to ensure that they access services. That is even the reason when I reached parliament, I had to sit on parliamentary health committee, I had to sit on HIV and AIDS parliamentary committees to ensure that what I could not help people the other side, I would influence this side to ensure that there are some things done. I want to know from HEVOS, other than advocacy. When you do this advocacy and things are on the table, what comes next? If we could convince health workers to provide friendly services to key populations, how about training these health workers, having, law enforcement officers, as we used to have them in safe spaces, speak to them, tell them about sexual reproductive health and rights of these young people. Why is it so hard? What can we do outside these conferences that we sit in? How can we move to our respective districts, to local governments, to speak to local leaders, to speak to district leadership, to speak to health workers, so that these people can get friendly services, especially health workers. I want to tell you that health workers, once you put them together and speak to them and tell them, because they are the same people who are receiving the backlash at the end of it all. When these young people get pregnant, they end up into the hands of the health workers. And I believe there are people we can speak to and convince, and they begin providing health-friendly services to these people. I want to know from HEVOS what we can do. Global Fund used to give us money to train these people, as I'm speaking. Where does your money end as HEVOS? Does it only end in advocacy? And after you're advocating for these rights and services and whatever, who is going to take the next step to ensure that these people get services? Thank you.
So once, between Kuza and Limpo, who's going to respond to the question? So Limpo responds, and then once she's responded, we'll hand it over back to Doc.
Okay, thank you so much, Honorable, for that contribution. Certainly, our work doesn't only end with advocacy, and that is why we work with youth-led and youth-focused organizations, because what we aim to do is, obviously, we can't be everywhere, but the work that our partners do is very instrumental, and they are the ones that actually work at, if it's county level, to provincial level, and at national level. So it's the way that we empower the organizations that we support for them to now see things at the way that you're actually speaking to it about, so that organizations are able to now spearhead those processes, because our work also extends to aspects of sustainability. So we don't want to be the ones in the forefront of making sure that we do those trainings and get down to the grassroots level, but for us to build the capacities of the organization so that they are then able to take it down to the levels at where they are reaching. So it's good that we have in our midst, I do not want to put our partner on the spot, but we also do have a couple of partners that we have here present. So maybe they could also speak to aspects of, other than advocacy, what else are they doing at grassroots level? Are they working with healthcare providers, et cetera, to see that the work that is done and the conversations that we have within the conference room go back to the outskirts and to exactly the reasons why we're actually sitting here today. Could I get you what you want to add to that? Or I can throw it to our partners. Partners, please. Can you say something?
Thank you. Okay, I will be very brief. Thank you very much, Nico, for your opportunity. Now, yes, like she mentioned, other than the funds that are released for advocacy, HIVOS currently is, we are doing a project under a fund called Regional SRHR Fund. And as much as possible, HIVOS gives opportunity for the organization to come up with a strategy on how they want to deliver services and program projects or programs. So it is upon the organization to develop what they think is according to the context necessary. This involves, for example, for Fiki's in Fiki's position, it involves capacity development for the organization. That HIVOS goes ahead and hires capacity development firms to support the organization develop the capacity to advocate, but also to be able to deliver services to the population, the local populations. But also part of the project that we are doing involves capacity development for the health workers. And personally, as we have done training of health workers in delivering SRHR services in the district where we are working, Wakiso district, working with the Ministry of Health and the DSO's office using HIVOS funds. Yeah.
Okay, thank you. Over to you.
Okay. I have followed the conversation and noted the passion and frustration in our member of parliament. And I was thinking about it. I'll tell a story again. So I got interested in adolescent sexuality when I was in the Senate from 1997. When for the first time I was in a situation where the Catholics told me that sex and sexuality is a gift from God. 1997, I developed interest, started to seek for the answers to address a certain issue I had in the past experience. And from 1997, I have worked and worked until I completed my PhD in law, focusing on adolescent sexuality in 2019. But the issue of adolescent sexuality is still tough. What I have done, I will tell you this, I've developed a certain level of confidence in engaging in this subject. That's what I've done, but I do not have the solutions. I try. Now let me express concur with you, because you're talking about parents allowing that girl. This safe space, I want to tell something personal. Can you stay here? Recently, my daughter came back from abroad where she's studying. She's above 18 years old. Then she made a request to her mother, my wife. I would like to visit a friend. She stays at another university, just the next district, but I'll come tomorrow. Then my wife response said, no. Then I was talking to her behind the benefit. But why do you say no? Then I rationalize what I understand. You see, she's above 18. Why are you refusing her? Say, no, you think You don't know what I think. If she's going to be having sex with boys there, so you think I can allow that? I say, well, she's above 18 and what? She said, no. We were strained for a few days because we had difference on whether my daughter, who's above 18, can go to her friend and spend the night. But I had to accept it that, okay, it will be like I did it first. Your frustration is very low. Even myself, someone who is a champion, my voice was curtailed, and I had to accept. Now, what I'm just trying to say, which is maybe what is compensation can, we should not imagine that this is going to be easy. And you know what? I have difficulties finding with the best practice in Africa. I can't find it. Okay, I can find little bits here. This has worked, but what has worked? The best practice, you know where I find it? Netherlands. Now, but when I put it before my colleagues in Africa, immediately it is blocked. That's Western. But Netherlands, in 1960, they decided that, no, we are going to address this teenage pregnancy issue. This is what we're going to do. We are going to accept that our children can engage in sexual intercourse at some point, and we're not going to really, prevent that. But we shall make them responsible. It's your responsibility. We'll teach you to be responsible, to delay sexual debut, to avoid pregnancy. And the health workers will provide the services to anyone who wants it and wants services. So it was a collaboration between the parents, the health system, and also the media industry. I see that as a best practice, but look, I fear to present it before you. The only reason I've said it is to make us understand that this issue is not going to be simple, but it is possible, because what is needed is a cultural transformation. To understand that that person, we can allow them the responsibility that it's fine. My role as a parent at a certain stage, I have to say, well, I've taught you, and you are now responsible. So even if you go out there and have sexual intercourse, well, I've taught you. But that is tough in Africa. As long as you are under my roof, I am in control. But we can still do something. Because even in the Europe, the process of getting to where it started a long time, and it was this very engagement. Now, the thing is, coming now to us, what is it that we can at least do now, even if the change is going to come later? That's the point. So when we asked you to engage in this, of course I didn't know that this is going to come up. That's one of the videos of this. That I prepared to track how things are going to go. I didn't prepare to speak like this. But because that has come up, we need to wait with our parents. At some point, maybe the parents will start to agree that we can give responsibility to our kids gradually, because when they reach a certain stage, even if they are under, well, we can let them do what they do. But now it's a challenge. Now, as I said, I wear different hats. I teach this in master's students at Victoria. There is an article from someone who did a research between America and Netherlands, and she published an article called "Must We Fear Adolescent Sexuality?" I tell you, when I give my students that article, it raises. They become so excited because it is describing that process. And the person did this research in the Netherlands and America. she asked the question, can you allow your daughter or son or to have a sleepover? You know, in Netherlands, the parent can allow their daughter to bring over John as a sleepover in their house. You see that? Already the reaction. That's how liberal Netherlands is. But I cannot bring it before you because you say, now you're talking about Europe, this is Africa. You get? So I can't bring it as a best practice. But when I look at the best practice in Africa, I'm very strained. But I will still take the very little steps we have made and I'll say, well, this is at least a best practice. We have moved a step, we have moved a step. So, let me go back to what G said. Now, let me also concur with that. We want those action plans to not be generic because it will just be everyday business. Yeah, we need all those, but we need to be specific. And maybe in the next stage, because we're saying in the next stage, we want a way forward. Can the countries pick maybe one action or strategy that they want to prioritize? That when we do this, we feel if we do this in this way, we can make a positive movement. What would that be? If you are confident, you can choose 2. If you are more confident, you can choose 3. But I think we shouldn't go beyond 3. Let us choose one thing. And that one thing, what resources are we going to need? How are we going to implement it? Because and it can be, that child friendliness that you're talking about is a very important issue, very key. Because we can't just say, oh, there's child friendly. What is child friendly? Do we need to do research? Someone talked about research. We need a lot of research on this continent. Also coming from, my heart, wearing my heart as a lecturer, I observed that as soon as the students were saying we want to do research on adolescent sexuality, their supervisors will say, well, it's going to take too long for you because you are going to meet the barriers from the research ethics committees. Then I was with colleagues later, and I said, if we continue saying this, do you know that we'll not do research in Africa on adolescent sexuality? But that kind of research has been done in our counterparts. They have worked with young kids and talked to them about sex and sexuality, but in Africa we are saying, no, let's not do this research. So what kind of research do we do? Adult perspective researchers without the true voice of the child. So one of the battles I'm fighting in the academia is, can we do research with young people? We will put all the safeguarding. We have our safeguarding policy, isn't it? Safeguarding, but we want that 15-year-old should talk to us about their sexual experience. And then when we take that to the parents, maybe now they'll start saying, oh, we have the evidence. But we have no evidence. So, what kind of research can we do? We can do on child friendliness. We know there's evidence that the child friendly services are there, but young people are not going there. Why? Maybe we know also why young people, but how can we create the system that the young people go there? So that child-friendly thing, we can easily talk about, oh, we have got child-friendly in Malawi, but it's not working. And we need research to understand why it is not working. In order that it can work. And if we can get 90% adolescents going to those services, we will make a big step. Maybe one country can choose, we'll just focus on just that child-friendliness. We don't need to do so much, but if we can make that movement, that from the, what are the percentages of adolescents doing child-friendly? You have the data? What is the data? It's not even there. And I remember someone from the Ministry of Health who was saying, we are not even allowed to collect that data. You see? Not even allowed to collect that data because why are you collecting this data? You will be using the evidence to tell us that these young people should be having sexual conduct. So you will not have this data. Can we then go back into our groups, short moment, pick one, and see if we can implement that. And for us, we should be thinking, if we do this in the next year, we are going to make a movement. So that next time when we meet in another forum, we'll be saying, that meeting enabled us to do this, and it has moved us a step towards the best practice we want. Is that reasonable to us? Yeah. One. And then move with that. We'll prioritize that and then we'll implement it. It will move us from point A to B. One. Can we do that, please? Just for how many minutes? 10 minutes? 15? We're just putting one. Okay. As long as you really try your best to go through, can you put that part to do that? That we pick this one, we are going to need these resources, we are going to need these strategies, and yes. And we are going, in order to monitor whether we have made a move, positive move, we are going to monitor it like this. The media people are tired already. They are gone now. They're like, oh, but yeah, because it was not shared, I think. So it needs to be put up. Am I speaking to myself?
Yeah. So we can move back to our groups quickly. In 5 minutes we get done when we come back, right? Hello. People are tired. You need the music again? No. So let's move to our groups. It's now 4 minutes. It's now 4 minutes. I see people have already identified their
So when I saw my cooking earlier, Hungary, country specific or just
Ice cream
and
panza.
also my cooking maximum earlier.
Skakero. Or 2 minutes. Nilienda kusendra picture yenye mamda. Apedza.
4.
Andi msati mapedza kuvhura. Anda muna andivhurira.
Friend.
Mande grade.
Ari 4.
Afresh message yangu.
Arifo.
General.
Arinda ku. Arinda ku see.
If you break my heart. Hakuna tukwalete jina.
Gani? 5. Aita 5.
Kana mangwacho.
Asma marko.
Tizuma face akaza dance.
Bansi. O programa ganhou. Sempre que o programa telefone.
for, like continuous accountability mechanism that after it's now in parliament, in the processing data of parliamentarians, so that's majority rule, because once it's debated in the National Assembly, if it does not fit in a majority rule, then it also doesn't go to the Senate, it never passes to the cabinet. So even that accountability mechanism has been checking with the parliamentarians who are for the motion, and they also become like the champions for changes in parliament, and to sensitize other parliamentarians and those who are even actually being passed. Otherwise, for Zimbabweans, we're very lucky. This is a low-hanging fruit that I think if we just collaborate together, we will actually put some change before the end. So I just hope that this platform will allow us to have a coordination voice and mechanism in place as our extension.
Thank you so much. Zambia? Oh, okay, let's appreciate Zambia in one. I want us to give them one hearty clap. Oh, Zimbabwe. Let's appreciate Zimbabwe. 1, 2, go. Somebody's on their phone. Let's appreciate Zimbabwe. 1, 2, 3, go. Thank you. Zambia? In 2 minutes, kindly.
In 2 minutes. Okay, thank you. Can I start here? Okay, yes. As among the participants that wasn't very clear with the instructions, but the group helped. Yes. And so what we're talking about here in our group in Zambia was saying that I think we've got a lot of guidance and direction from the government's perspective. But what we've identified today as a major problem is that I think we have a lot of work to do around coordination. And so we feel that it's urgent that we convene the SRHR Youth Access Group. And so we've made some very intentional steps on how we're going to go about it. We have the CSE task force, which really worked well, especially in the season where we have the backlash. And it still stands as a very solid group. So we want to mirror its practices, and we want to use this SRHR Youth Access Youth Group as an entry point for addressing a lot of issues that we identified as they relate to access. Issues of legislature, issues of engagement with the government, and issues of just reaching the ground and ensuring that the voices of young people on the ground are also encompassed. We want it to be a think tank of some sort. So yeah, we'll work out the modalities on how we're going to do that. Thanks.
Okay. No, we do it in a better way. Okay, again, another hearty clap for them. 1, 2, go. Another one. Thank you.
Which country?
As Malawi, I think we also share in the same perspective of our Zambia. Yes, but completely said yes. Number one, yes. Because yeah, and issue of coordination is also very important, and we really maybe want to have that in the Ministry of